Hello, this is Dr. Moy. This represents the third and final video on the implementation of the Institute's cancer research based on the background provided in the first two videos. From session 1 and 2, we discussed some highlights. New targeted therapies are not on the immediate horizon to displace chemotherapy. Each patient's cancer has a unique biology. And cancer is difficult to eradicate because of drug resistance. Drug resistance is dependent in part on cancer stem cells, drug activity, and drug penetration. Thus, there is a practical need to predict whether the standard administered dose of chemotherapy will kill a patient's cancer. To predict whether standard administered dose of chemotherapy is effective in killing a patient's cancer, we have developed technology to extract and grow a patient's cancer cells under artificial conditions and test their susceptibility to a panel of standard chemotherapy for treating colon cancer. As shown in the graph, each drug appears to have a different toxic effect on colon cancer. The plot displayed on the far left represents the drug that had the most toxic effect on colon cancer cells. The plot displayed on the far right represents the drug with the least toxic effect on colon cancer cells. And the plots in between the two represent drugs in which have intermediate toxic effects on colon cancer. Now, this data illustrates two important points. First, we believe that we can identify which drugs would kill a patient's cancer. Second, we estimate the dose of chemotherapy that could kill a patient's cancer and determine whether that dose falls within the therapeutic window of the drug administered. So we are investigating whether this direct functional approach of testing cancer drugs on a patient's cancer outside of their body can predict the desired clinical outcome of reducing the burden of tumor in a patient. We know that tumors have three-dimensional architecture. So if we take the most potent cancer drug from the prior example and deliver it to the same cancer cells, but now arranged in a three-dimensional tumor, we see a different result. As shown, only those cells located on the outer perimeter are susceptible to chemotherapy, leaving the internal cancer cells unaffected. Also, the larger the tumor, the more difficult it is for chemotherapy to penetrate and kill cancer cells. So based on this background, the Institute has launched a research study. The objective of this study is to evaluate and optimize a chemotherapy test. We are looking to recruit patients with advanced breast cancer, lung cancer, or colorectal cancer who will be receiving chemotherapy. This study is open to cancer patients who live in the United States. This represents a collaboration between the Institute and a biotech company called Cellular Engineering Technologies. Now, the inclusion criteria includes the following. We are looking to recruit patients with advanced breast cancer, lung cancer, and colorectal cancer. Patients must be receiving or will be receiving chemotherapy. Patients must be competent to provide informed consent, and patients who participate should be willing to provide ongoing medical history and clinical follow-up as they receive chemotherapy. To perform this procedure, we require fresh cancer tissue, either from a diagnostic biopsy or from a surgical biopsy. This tissue needs to be shipped by Federal Express within 24 hours of a diagnostic or surgical procurement. The exclusion criteria includes the following. We are excluding patients who do not have advanced cancer. We are excluding patients who do not have breast, lung, or colorectal cancer. We are also excluding patients with childhood cancers. We are excluding hospice patients. We are excluding patients in which their physician is unwilling to treat him or her with chemotherapy. We are using the following protocol for the study. The timing of this procedure is critical. Patients who are anticipating elective diagnostic or surgical procedures should contact JP2MRI. Patient or their physician should contact JP2MRI and sign a release of medical information. The Institute will send a tissue collection kit to the point of contact. A fresh tissue sample is to be collected and returned by FedEx. And a best effort will be made to isolate and grow a cancer cells, which will take approximately 30 days. Testing is performed with standard chemotherapeutic agents, and patients will be approached to provide follow-up outcome clinical data, which includes medical history, laboratory, and radiologic information. The risks of the study are the same risks associated with a diagnostic biopsy or a surgical procedure to obtain cancer tissue. If the procedure is successful in growing cancer cells and successful in performing drug testing, the results will be made available to the patient and their treating physician. Yet it is up to the patient's treating physicians to make a final determination of how those results will be used or not. As a disclosure, I am the CEO and co-founder of Cellular Engineering Technologies. For further details, please contact JP2MRI at 319-688-7367 for further information. Remember, your donations go towards supporting this medical research. JP2MRI is a 501c3 nonprofit that specializes in finding cures and better therapies exclusively using a variety of ethical adult stem cells and cancer cells. JP2MRI is one of only a handful of pro-life medical research organizations that does not support or participate in any embryonic stem cell research. Also, the Institute devotes a majority of its expenditures towards scientific research, while most national not-for-profit medical foundations devote much less of their expenditures to actual research. Further, the Institute is entirely focused on reducing the time and cost to get therapies through the regulatory process. To learn more about JP2MRI, go to our website at www.jp2mri.org and consider a donation. Also, tell your family, friends, schools, and church groups and social media networks about the Institute's mission. Thank you and God bless.